Dear viewers, welcome you all to our show OSA, that is Orthopaedic Solution Academy. Hope you all are well during this COVID-19 pandemic situation by wearing masks and keeping distance with each other. Dear viewers, today our topic is a different topic, that is organ-saving technique calcanization for the treatment of total bone defect due to infection by Ilizarov. Definitely, it's a new topic, and our speaker is Dr. Anatoly from Kurgan, Russia. I would like to request Dr. Anatoly sir to join with us. Dr. Anatoly sir, welcome to our show, Orthopaedic Solution Academy. Thank you very much for joining with us.
Hello, everybody.
Hello, sir. Dear viewers, we have three learned academic experts with us. One of them is Professor Novikov sir, highly academician from Kurgan, Russia. Sir, welcome to our show, Orthopaedic Solution Academy.
Good afternoon, dear colleagues.
Good afternoon, sir. Dear viewers, we have the legendary Ilizarov surgeon from Bangladesh, Professor Mofakhkharul Bari, sir. I would like to request Professor Mofakhkharul Bari, sir, to join with us.
Thank you. Good afternoon, everyone.
Good afternoon, sir. Dear viewers, we have another enthusiastic Ilizarov surgeon from Patna, India. That is Dr. Shamsul Huda, sir. I would like to request Dr. Shamsul Huda, sir, to join with us.
Thank you, and good afternoon, Dr. Tanvir.
Thank you very much. Dear viewers, you can also catch us on the OrthoTV, as because of OrthoTV is also telecasting this program. Now, I would like to request Dr. Anatoly, sir, to start his presentation. I would like to request Dr. Anatoly, sir, to share his screen with us. Please, sir.
Everything is good?
Not yet, sir. Yeah, it's coming.
It's coming.
Yeah. It's fine.
Okay, good. Dear colleagues, today we will talking about organ-saving technique, calcanization for the treatment of total hand foot bone defect due to infection. As we everybody know, foot and ankle stomatitis, it is due to various etiologies, makes up to 38% of the total skeleton cases bone infection. Lessons of the hind foot are 64%. In 8.5% of stomatitis cases in the ankle and hind foot, transtibial level amputation is treatment option. But many patients would like to preserve their limbs. The Ilizarov methods provides salvage of the foot and service hind foot stomatitis cases. So totally we have 25 post-traumatic patients with spinal trauma, 33 patients, gunshot wound, 1 patient, and traffic accidents. That patients had total hind foot bones defect. Manifestations of that local view of that patients was presented like affected function, defect of the hind foot and articular parts of the tibia, and defect of the calcaneus, ulcers, fistula, neurotrophic disorders, and polymicrobial population. In most cases, with inflammation of the ulcers, we find it Staphylococcus aureus. So in 7 cases, we find that ulcer was not more than 3 centimeters And in most cases, in 18 cases, ulcers was be large and more than 3 centimeters. So in X-ray picture, we 6 patients have total calcaneum defect, and 19 patients had total calcaneum, talus, and sometimes, in some cases, distal side of tibia bone defects. So, and in first group of the patients was included patients with total calcaneum bone defect. And for treatment that patients we used technique, two-stage techniques. In first stage was done arrest of infection, where was made radical sequester necrectomy, ulcer wound stitching, and Ilizarov fixation, and finally etiologic antibiotic therapy for 2 weeks. After surgery, after removal of infection, was started second stage when was done reconstruction of the foot function, and that stage was consists from 3 steps. First step, when we made arthrodesis of ankle joint. Second step was done reconstruction of the tibial distal proximal side tibial osteotomy for tibial transport in hind foot bones, and totally time of destruction in that step was 3 or 4 centimeters. And the last step, when was create rotation of the distal tibial fragment backwards after distal tibial osteotomy. So, and for that group, case female patient, 25 years old, with spinal trauma, with neurotrophic disorders in lower extremity, soft tissue ulcer and fistulas in left hind foot. And with that view, patient was admitted in our department, where where was done in the first stage a radical sequester necrectomy with Ilizarov fixation for healing wound, soft tissue wound and soft tissue defect. After radical sequester necrectomy was started second stage, and the first step where we was done ankle arthrodesis. Ankle arthrodesis was done by simple Ilizarov method. Was in previous type of external device was admitted one more half ring with 2 wires which fixed talus bone, and creation of the compression for creation of ankylosis of ankle joint. So next one step was started after 30 days after step A, and in that step was done in proximal side tibial osteotomy for bone transport in hand foot, and totally time of lengthening was 40 centimeters. And after bone transportation was started last one step C, where was done distal side tibial osteotomy, and after that osteotomy, lengthening with turning of that distal bone fragment was 15 days. And after lengthening, after transfer, after rotation of that distal fragment, external fixator was changed for creation of the conditions of the compression between midfoot and created new hindfoot bones. That compression was done for creation of healing of fusion that bones. So, and after that totally fixation was 6 months, and follow-up of that patient we have now more than 5 years. Patient she have good function of that limb. She not have of recurrence of infection, and she walk with full pressure on his limb. So another one group, it is a group which doesn't have talus bone, and in that group was treatment was consist from two stages. In first stage, like in previous group, was done arrest of infection and radical sequester debridement, ulcer wound stitching, and Ilizarov fixation with antibiotic therapy for 2 weeks. And in second stage, the second stage was consist from 2 steps. In first step, reconstruction by destruction after proximal tibial osteotomy, and totally destruction was 14 or 16 days. And step B, where was done transposition and rotation of the distal tibial fragment after distal tibial osteotomy, and totally transposition that fragment was 10 or 15 days. So, and the case for that group, a male patient, 51 years old, after shotgun injury of the ankle and hindfoot, and with that clinical view and X-ray view, patient was admitted in our department. In the first stage was done debridement with radical sequester necrectomy. Totally, we take total hindfoot bone defect with distal side, with defect of the distal side of tibia and lateral malleolus. So After stitching wound, after healing wound, was started second reconstruction stage, where in the first step was done in proximal side tibial osteotomy, and for bone transport, for creation enough bone in the hind foot place. So, and after that step was done another one step, another one osteotomy in distal side of tibia, and rotation of that distal tibial fragment, bone fragment, in hind foot place, and after that, between new hind foot bones and mid foot bones was created compression for healing, and and after compression, total fixation was 8 months in Ilizarov fixator, and after just a moment, something wrong with my presentation.
Bari,
Yeah, it is hanged, sir.
Ashraf.
Yes, sir. Move forward to the next slide, sir. It is hanged, sir. If you have any problem, then you can go to the previous slide also.
Yeah, we have some problems.
Okay,
Yeah.
you can start from the first slide.
Just a moment. We will try to do something with it. Yeah.
Sir, you can start from the beginning, sir. I think that will be easier.
Yeah.
Due to network.
Just a moment. Yeah.
You go to the first slide.
Yeah. Just a moment, because here is PowerPoint is something don't work.
Visit the PowerPoint and
we will restart.
Yeah, no problem, sir. Sometimes it happens.
Yeah.
Dear viewers, we're waiting for restarting our presentations due to some technical problem. And I think that was a great presentation. We were watching. We'll connect within a few minutes or within a few seconds.
Я думаю, это
Из видео.
она ищет, да. Она ищет поддержку, ты сейчас к ней подходишь.
The very novel technique. You can completely regenerate a
Да, сейчас.
Just now, отключи звук.
Yeah. The way you were saying something about the newer technique.
This about the same technique. This is a very novel technique where we can completely reconstruct a full bone, like calcaneum. I just wanted to ask Bari sir and Novikov sir, can we do this for other bones also, like patella, like femur head, like humerus head, with Ilizarov?
Yes. No, you see, we sometimes we're doing segmental bone transport. And
Right,
this
sir, right.
calcanization I am doing all the time. Calcaneum lengthening, you don't have lower part of the foot. You can transport the lower tibia and you can make the calcaneum. You can, whatever you like, you want to do that. You
Right,
just
sir.
do a osteotomy in the lower end of the tibia and just remove and you can make a calcaneum. You know, Professor Shipsov, he has a very good book about the foot. Fantastic book. Next time I'll show you the slide of that book.
Right.
The only the foot. There everything is done, written, how to go for this calcanization. Big defects, you can
Right, sir.
gradually lengthen and you can mold whatever you like. Right side, left side, you can do. This is the beauty of Ilizarov. That's why about Ilizarov, it is very important. Ilizarov, feel any defect in life of bone. If bone is viable, you can feel the defect. When these are the cases that he has shown, very difficult cases, no lower end of the tibia, even calcaneum, even talus. Then when you are hopeless, you can do something with this Ilizarov technique. See?
That's the hope, sir.
Yes. And by doing this, you are extending the quality of life. Oh, okay. He's now in the...
Yes, sir. Yes, sir. We can see your screen now, sir.
We are ready.
Yes, okay.
Yes, sir, please.
Start.
Dear colleagues, I see my slides. Yeah.
Yeah.
Okay, so we are stay here. Yeah. So, and after fixation, 9 months of fixation, we take a good result. Unfortunately, my video slide is not short because, and in that video, I want to try to show good function of that patient, how he walk, how he can stay walking in all surfaces. I mean, in a forest, when patient can walk in a forest, in simple roads. So, and total follow-up of that patient, we have now more than 7 years. Patient walk, don't have recurrence of infection. So, and all cases, all 25 cases which was treated in that technique, in all cases we assess it as a good results. We arrest infection in all cases, arrest ulcers and fistulas, and was healed ulcers and fistulas. So all bone defects in hind foot was healed, and in all cases function of their limbs was improved, and all patients can walk. So calcanization is a complex method of treatment that requires a lot of effort and time from the doctor and the patients. but at the same time allows to save and restore the function of the affected limb. So thank you for attention. And in the slide you can do print full screen, and here is my contact for collaboration, for some questions. I will try to answer for everybody. So thank you.
Thank you very much, sir, for your excellent presentation. And I think that is one of the rarest presentation for sure. Now, I would like to request Professor Mofakhkharul Bari sir to say something regarding the presentation.
Thank you, Anatoly Sudnitsyn. Great presentation. You have shown the difficult cases, and during your presentation, just I was talking about the big defects, ulcers and fistulas in the calcaneum region. So, and regarding your presentation, 3-step surgery, sometimes I myself do at the same time go for proximal tibial lengthening and correcting the defects in the calcanization in the lower part. But you are doing first step this and then going for the lengthening and the distal lengthening and the arthrodesis in the hind foot or midfoot. This is good, but I myself doing the lengthening and at the same time correction of the defects of the calcaneum or the tibia or the talus. So this is a learning technique, that is calcanization is a very good method. Again, here goes to the principles of Ilizarov. When you are doing for the distraction, slow and steady traction on the living tissue creates a stress which is metabolically activated in both biosynthetic and proliferation. Biosynthetic and proliferation when there is a living bone and at the same time metabolic changes are going on, and you are getting, Professor Ilizarov shows in 1983 that 330% circulation increases in case of these principles, destruction when you are applying. And it helps in arresting the infection. And that we are getting in case of this kind of big defects in the ankle and the foot. And this is the surprisingly unbelievable method that we can do by Ilizarov. And the disabled man we can make able by doing this kind of surgery, calcanization. And for the disabled people, we have a bright future. The cases that you have shown, fantastic. I myself would like to congratulate you and thank you, both of you, from Kurgan Center and the OrthoTV and from Indian fellows and our Dr. Tanvir. And this is a learning session, I think so, for all the young and knowledgeable orthopedic surgeons. Those who wants to know what to do when you have nothing to do. When all lights are off, the light of Ilizarov is on. That is the technique. Thank you very much for your nice presentation. Thank you again.
Thank you very much, sir, for your encouraging speech. Now, I'd like to request Professor Novikov, sir, to say something, sir.
I want once more congratulate all of us with another technique, excellent, beautiful technique, and I want to congratulate my colleagues from very heavy department. When inside of infection, doctor can find individual plan of treatment, because all of these patients absolutely different. And very interesting when long bone during the treatment, during the change position, during the correction, change his quality and start take weight bearing, because this is not same condition like calcaneus. Tibia, when on the end of treatment we check, this is long bone is ready for a new function in our body, for real take weight bearing. And once more, with this technique, patient go away from osteomyelitis. I cannot believe, but this is true. Doctor back all this patient to the normal life. Patient can use normal shoes, can walk without any support. This is fantastic, and I cannot imagine how doctor without Ilizarov can support of this patient. I am happy doctor, and because I have in my hand this is magic methods, and this is just now I can say doctor who will follow us, and I'm absolutely relaxed, because we have some team who will follow our philosophy, our methods, and just now each patient has something news, and this is news from brain and hand and from experience of young doctor. This is once more Ilizarov give possibilities for any doctor all of the world. And in our experience, something new, because each day we have evaluation, and each day we have new level of our treatment. Congratulate all of you, and thank you for Dr. Sudnitsyn for his presentation.
Thank you very much, sir. Now I'd like to request Dr. Shamsul Huda, sir, to say something. And I have a question to Dr. Shamsul Huda, sir. Are you doing this type of calcanization in your hospital?
Thank you, Dr. Tanvir. First, I would like to congratulate Dr. Anatoly for such a wonderful presentation, proving again that Ilizarov can do all the impossibilities and do wonders. I'm not doing this type of cases, but I've been reconstructing like distal femur or proximal tibia reached sometimes, not to this much level. So I have two questions from Dr. Anatoly. Number one, after doing the complete calcanization for arthrosis, the foot, do you change the rings or you use the same ring for orthodesis with the region? Yeah.
Sometimes in every case is unique, because I mean same case is very unique cases, and because it sometimes if we need to change some rings or some wires, we can do it. We should understand, we here like pointers in orthopedic, pointers in that technique, and each one doctor is a pointer for each case. And here is, if doctors think that much more better if in that case he should change wires or rings or half ring, everything, you should do it. The doctor should do it. So, and we understand that it is not that technique calcanization. There is no standard technique. We know only standard principles, but in every case you should do some new some create some better condition for that patient, and because it change wire, change rings, change everything, but create good function, restore function, and create good condition for that patient. Yeah, I think that, yeah.
Thank you. My second question is that just like you have done calcaneal regeneration, have you tried the same for other parts like wrist, distal femur, proximal tibia, humerus head, and other parts? Similar techniques for other joints.
Bari, помоги, мы не поняли, при чем здесь бедро, плечо, предплечье?
Да, однаково методика вы используете, которую вы calcaneum сделаете и тибия бедро сделаете. Одинаково? Техника, принцип.
Принципы везде одинаковые, это принципы Ilizarov основополагающие. It's basic principles of Ilizarov method, Ilizarov, and that principles can work in every segment, like shoulder, like femur, like everything, every place.
Yes.
It's same principles, same Ilizarov principles.
Right.
Same question to Bari, sir.
Yes, the question you asked, he already replied. I was just talking to it in Russian language. The principles say that whenever I do any Ilizarov surgery, I keep it in mind always, slow, that I repeat all the time to my students and everywhere. Slow and steady traction on a living tissue that may be in the calcaneum, lower tibia, anywhere, which is metabolically activated, which stimulates histoneogenesis in proliferative and biosynthetic pathways depending upon the vascularity and the functional use. This is the theory. If you have vascularity, you use that limb, you'll get a fantastic result by doing the principles of Ilizarov, slow and steady traction. You do the osteotomy, as for example, I'm telling you again, you don't have calcaneum. You have only talus. Listen, just do your osteotomy oblique in the lower end of the tibia, put the ring, gradual distraction, you just go behind, you can make it just like a calcaneum. And Professor Shepsov has written a very fantastic book of foot. You know, Anatoly and Sudnitsyn and
yeah, I know.
You have a foot surgery, fantastic book, and they have everything there regarding this calcanization, flat foot, cavus foot, and this, no bones in the backside. You want to make the foot, you can do that. And the pictures he has shown in his presentation. Thank you very much.
Thank you, sir.
Thank you very much, sir. It was a nice discussion. I would like to ask one question to Dr. Anatoly, sir. Sir, is there any special rehab protocol for this type of patient?
I told it before. Here is we don't have a special treatment protocol because only typical principles, because here is we have 25 cases and every case is unique. Every that case is unique and absolutely different case. Totally all cases is considered only principles for healing that bone defect only. And because we don't try to create protocols or everything.
Okay, thank you very much, sir.
Very sorry, because sometimes real protocol disturb us. When we have standard, some patients we cannot put inside of standard. And this is protocol will disturb treat this patient. And I'm happy because Ilizarov methods give possibilities for each patient find some new protocol.
Right.
That's a great thing, sir. That's a great thing. Thank you very much, sir. Thank you very much, all of you, for being with us. And I would like to thank Raj TV for helping us to arrange this type of academic program, and definitely Renato Pharmaceuticals Bangladesh Limited for sponsoring this program. I'm Dr. Tanvir Ashraf saying bye-bye today to you. But we will see in the coming Friday with another magical topic of Ilizarov. Till then, I would like to say bye-bye to all of you. Bye-bye.
You are watching Raj TV, Jagorone, Bangladesh. Please subscribe our channel.
Going to talk.
Wonderful.
Wonderful, sir. Excellent presentation, sir. That was a rarest presentation, sir.
Next Friday again, Anatoly.